Well, we've all heard horror stories about back surgery gone wrong, leaving patients in even more pain.
Yeah, a local surgeon is hoping to give patients their mobility back with a procedure that he says has almost no downtime and good results. Tisha Powell met with some of his patients who are singing his praises. She joins us with more now. Tisha?
Fred and Anna, neurosurgeon Dr. Dennis Ballard at Triangle Neurosurgery in Raleigh says there's a minimally invasive way to get patients back on their feet who are suffering from conditions that cause debilitating back pain. In fact, some can leave the hospital in less than 24 hours. But he adds, often the tricky part is convincing patients putting off back surgery that it will work for them. Wayne Carlson can now stand straight up and walk with ease, something he wasn't able to do for years until back surgery changed his life.
If I stood up straight, it was excruciating because it was pushing my nerves together. And it was easier for me to lean forward than it was to stand up straight.
It's a similar story for Wayne Carlson, Gregory Owens, and Polly Smith of debilitating back pain that nearly destroyed their lives.
The pain would just be so bad and it would radiate down my hip, down into my leg, and my toes would be numb. The nerve was being pressed so hard.
I felt it from my waist just down, just so much pain.
Pain Dr. Dennis Ballard was able to eliminate with a procedure called unilateral lumbar fusions, a minimally invasive procedure that requires little downtime but works wonders for patients who are suffering but have limited time and options.
A lot of people are putting off surgery because they're worried about losing their job or paying bills or the other things. And I know this is a nationwide trend, but it's really more so now than ever.
Dr. Ballard begins with the smallest incision, disturbing as little muscle and soft tissue as possible. He then uses a tubular system.
You can come in from the unilateral side, work through the tube, do whatever decompression you need, free up the nerves, and then go into the disc space.
A metal cage like this one is then inserted into the disc space, easing patients' pain.
This is a good operation for some people. Not without risk. I mean, there's always risk, but you know, it is something that can help some people.
3 of them in this room.
I actually walked so much after surgery that the nurses made me get back in bed. Wow. Because I was just so happy that I could stand up straight again.
Dr. Ballard says with this procedure, there's minimal scarring and less pain than some of the older methods. Some who were afraid to go under the knife, especially the patients we talked to, are grateful they finally did. Anna, Fred.
Yeah.